Hello, I'm Rachel Sacido. Presentation by me about paraphilics, more specifically necrophilia. So first I want to start off with the definition. So paraphilias involve sexual arousal to atypical objects, situations, and or targets, like children, corpses, and animals. Some people could say this is out of the norms, not socially accepted. So these are some of the differences between normal and deviant behavior. On this first row, I have normal behaviors. Second row, I have deviant sexual behaviors. So I'm just going to compare these. Normal behaviors are consensual. You have two partners and they both consent. Also, they communicate on what they want, what they need sexually, pleasure. Also, when this happens, morals are always involved with normal sexual behavior. So, as we look at deviant sexual behavior, most of the time there's no consent. It's from unsuspecting victims, such as one paraphilic disorder is like stalking their victims, they're unsuspecting. And then abnormal mental process, that's more like they think it's okay that they do these things, they justify it somehow. And subcultures, this just talks about like the different types of disorders, such as like obviously necrophiliacs, pedophiles, exhibitionists. Yeah. Here's some of the characteristics of paraphilias. So there's arousal to atypical objects, as we've seen in the definition, such as children, animals, and corpses. These cause stress in important functioning areas, such as socially and personally. Sexual arousing fantasies, reoccurring, persistent. This means that these like fantasies, they don't happen just out of the blue. This is what the person needs to get aroused and have an orgasm, things like that. And it also causes anxiety, depression. So when people are experiencing anxiety and depression, they look towards their fantasies and try to please themselves, and it usually helps with their anxiety and depression. So diagnosis, these are just some of the things that fit the criteria if someone does have a paraphilic disorder. So it must be apparent for at least 6 months. It goes along with the persistent, reoccurring fantasies. Cause problems with functioning, as I said before, personally and socially. There's blood pressure tests. So like they'll put like pictures or scenes up and they track the blood pressure. And then they could be determined to be a threat to others, such as children and like rape victims. And then there's also a psychosexual evaluation that just makes the person who's getting evaluated more comfortable about speaking about it and getting tested, getting diagnosed. Basically, it's kind of like a self-assessment they could do at home in the comfort of their own home, to get help. So that's another way they could do that. Here's some characteristics of necrophilia. So first I'm going to start off with the definition. This is just a general definition. There's about 4 types of necrophilia. So a person who is sexually aroused or has sexual intercourse with a corpse. This isn't always the case. With necrophilia, it branches off, as I said, into 4 types. They don't always have to be sexually aroused or have sexual intercourse with the corpse to be a necrophiliac. They could just be attracted or like this, like the smells, or just like touching the corpse can satisfy them. So as we go down, there's smells. It's kind of exotic, erotic type. Homicidal necrophilia, that's one type where a person will kill their partner just to satisfy their needs to have sexual intercourse with a corpse. And usually when there's a history of sex doll use, some people are necrophiliacs. And so fantasies about the corpse. This is more like the person who's attracted and having sexual intercourse with the corpse can have many fantasies about the corpse since they're non-responsive. They could do what they want. They can imagine the corpse however they want the corpse to be. And necrophiliacs are usually antisocial. There's a conduct disorder. And their conscience is lacking. So here are a few statistics. So less than 2.3% of the population have paraphilic behaviors, and then less than 15.9% of the population have atypical behaviors. There are some scientists who studied 211 closed cases, and 16 of them came out to be necrophiliac related. So here's some of the development of necrophilia. Let's start off with childhood. It could be like smells related. The smell related can bring nostalgia or a feeling of comfort from like dead animals or dead loved ones. And then psychoanalytic. As a child, they could be improperly socialized, which does cause them to develop a personality disturbance. And cognitive behavioral reasons. There's 3 stages of moral reasoning, and if the child does not develop these 3 stages, it does develop into necrophilia. So here's some treatments. There's the cognitive behavioral therapy, orgasmic reconditioning, and taking anti-androgens. Some of these aren't really helpful, but it's better to get treatment than to just leave it alone and it could escalate and they can become a criminal. This is just an extra slide. I wanted to include some, I guess, famous people, more known. So there's Ted Bundy, Jeffrey Dahmer, Karen Greenlee. And I did read this article, I cited it in my works cited, that Sleeping Beauty is like correlating to necrophiliac fantasies, which I thought was interesting because I never realized that. And it kind of does make sense because she is kind of like a corpse. I don't know, I just thought that was interesting to put in. But here's my works cited page. And thank you.